You walk across a flat, open floor. Nothing in your way, nothing to trip over. And yet, for a brief moment, your body drifts. A slight wobble. A step that doesn't land exactly where you expected. You catch yourself, you keep moving, and you tell yourself, it's nothing. Maybe your legs are getting weaker. Maybe you just need more exercise. Maybe it's age. But that assumption right there is where most people go wrong. Think about this for a second. Picture 3 people who can't walk in a straight line. A stroke survivor, a man who's had too much to drink, and a baby taking her first steps. All 3 of them wobble. All 3 of them struggle to stay on a steady path. But no one in their right mind would say they all have the same problem. And yet, when it happens to you, you treat it like it's just your legs. So you start doing squats. You look up balance exercises online. You buy supplements for your bones. And nothing changes. Because the truth is, if you're drifting when you walk, if you feel unsteady, on perfectly level ground, this is not a leg problem. It's a control problem. More specifically, it's a problem in a part of your brain most people have never even thought about: the cerebellum, the part responsible for timing, coordination, and keeping you upright without you having to think about it. And here's where it gets even more interesting. Most people have no idea there's one tiny point at the base of your neck that quietly controls how your entire head moves. And when it stops moving the way it should, your body starts compensating in ways you don't even notice. Your shoulders tighten, your posture shifts, your balance starts to drift just slightly at first. And over time, that small, silent change begins to affect how your brain receives blood and how well your cerebellum can actually do its job. Right now, there's a simple way to check if that area is moving properly, and almost nobody does it correctly. Stay with me, because in the next minute, I'm going to show you exactly where it is and how to tell if your neck is silently becoming a problem before the pain even starts. And more importantly, I'm going to walk you through 6 specific methods to fix this, ranked from the least effective to the one method that changes everything. Because the number one solution, it's not complicated, it's not expensive, and there's a very good chance you've been doing it wrong your entire life. Now let's slow this down for a moment, because if you don't understand what's actually happening inside your body, everything you do after this will feel random. Walking feels simple, automatic, something you've done your entire life without thinking. But in reality, walking is one of the most complex movements your body performs. In fact, walking is controlled falling. That's not a metaphor. That is literally what is happening every time you take a step. Each time you move forward, your body shifts its weight just far enough that you begin to fall. And at that exact moment, your leg swings forward to catch you. Then it happens again and again, step after step. So the question becomes, what keeps that process smooth instead of chaotic? The answer is timing. And the structure in your body responsible for that timing is something called the cerebellum. Think of the cerebellum as your body's balance computer. It sits at the back of your brain, and every fraction of a second, it's processing an enormous amount of information. It's tracking input from your eyes, where you are in space, from your inner ear, how your head is moving, from your muscles and joints, where your limbs are positioned. Then, based on all of that data, it sends out tiny, precise corrections to keep you upright and moving in a straight line. When it works well, you don't even notice it. You walk, turn, adjust effortlessly. But when it starts to slow down even slightly, that's when things change. Your steps become less precise. Your timing drifts. And instead of smooth, controlled movement, you start to feel unstable. Now here's where this becomes especially important as you get older. Because this is not just about coordination. It's about supply. The brain is an organ, just like your heart or your lungs. And like any organ, it depends on a steady flow of oxygen-rich blood to function properly. And the brain is incredibly demanding. It makes up only about 2% of your total body weight, but it consumes roughly 20% of all the oxygen you breathe. 20%. That means even a small, chronic reduction in blood flow doesn't go unnoticed. It affects performance subtly at first, then more clearly over time. And this is exactly what tends to happen after the age of 50 or 60. Blood flow becomes less efficient. Oxygen delivery drops. And the parts of the brain that require the most precision, like the cerebellum, start to show it first. Not dramatically, not all at once, but in small ways that are easy to dismiss. You walk into a room, and suddenly, you can't remember why you went there. You start a sentence, and halfway through, the thought disappears. By mid-afternoon, your mind feels heavy, slower, like it's running on low battery. And then there's that feeling patients often struggle to describe. They call it brain fog, like thinking through a layer of cotton. Everything is still there, just slightly out of reach, slightly delayed. Most people treat these as separate issues. They think memory is one problem. Fatigue is another. Balance is something else entirely. But they're not separate. They're connected. They're all signals pointing back to the same underlying issue. Your brain is not getting the level of blood flow and oxygen it needs to perform at full capacity. And the cerebellum, because of how precise its job is often one of the first places where that drop in performance becomes visible. That slight wobble when you walk? That moment of instability? It's not random. It's your body showing you, in real time, that something deeper is starting to change. And the important thing to understand here is this. This is not something you wait for until it becomes serious. This is something you catch early, because early changes are exactly where the biggest improvements can happen. Now that you understand the real cause, let's talk about solutions, but not in a random way. I'm going to rank them for you from the ones most people try first, to the ones that actually make a measurable difference. Because if you start at the wrong end, you can spend months doing the right effort in the wrong place. Let's start at the bottom. Number 6, traditional leg training. This is where almost everyone begins. Squats, calf raises, resistance bands, trying to strengthen their way out of instability. And on the surface, it makes sense. If you feel unsteady, your instinct is to make your legs stronger. But here's the problem. Your legs are not the issue. They're the hardware. And in most cases, the hardware is working just fine. The problem is the control system. You can build stronger legs, but if the timing from the cerebellum is still off, your steps will still drift. That's why this scores just 2 out of 10. Not useless, but not addressing the root cause. Now, number 5. Incorrect neck stretching. You've probably seen this or done it yourself. Tilting your head side to side, rolling your neck, pulling your ear toward your shoulder. It feels good in the moment. But most of that movement happens in the mid-cervical spine around the C5 and C6 levels. That area is already the most mobile part of your neck. It's not where the real restriction usually lives. So what happens? You keep stretching the part that's already moving and ignore the parts that are actually stiff. In some cases, aggressive stretching here can even increase irritation. That's why this only scores 3 out of 10. It feels like you're doing something helpful, but you're missing the target. Number 4, basic neck massage. Now this one does have value. When you massage the muscles around your neck, you reduce tension. You improve local circulation. You may even feel immediate relief. But here's the limitation. Massage relaxes the surface. It doesn't correct the underlying mechanical restriction. If there's a specific segment in your neck that isn't moving properly, massage alone won't restore that motion. So yes, it helps, but temporarily. That's why it sits right in the middle at 5 out of 10. Now we start getting into what actually makes a difference. Number 3, releasing the lower neck, the C7 to T2 region. This is where things change. This area, right at the base of your neck, is one of the most common places for chronic restriction to build up. It's where that subtle hump begins to form. Not fat, but a buildup of tension, stiffness, and limited joint movement. And anatomically, this area matters more than most people realize. Because the arteries supplying blood to your brain, the vertebral arteries pass directly through this region. When these joints become restricted, even slightly, it can influence how smoothly blood flows upward. Not enough to cause something dramatic like a stroke, but enough, over time, to reduce efficiency. So when you begin restoring movement here, gently, correctly, you're not just improving flexibility, you're improving the pathway that supplies your cerebellum. That's why this jumps to a 7 out of 10. Now, number 2. Proper stretching of the sternocleidomastoid muscle, the SCM. This is one of the most influential muscles in your entire neck. It runs from just behind your ear all the way down to your collarbone. When it becomes tight, and it often does, with posture, stress, and aging, it pulls your head forward. And when your head shifts forward, it changes the alignment of everything beneath it, including the blood vessels. A chronically tight SCM can create subtle but persistent pressure on surrounding structures, including the arteries that feed your brain. But here's the key. The technique has to be precise. You stabilize the collarbone. You gently tilt the head away and slightly lift the chin. No forcing, no jerking, just controlled tension. Done correctly, this has a direct effect on posture, alignment, and circulation. That's why it earns an 8.5 out of 10. And now, number 1. Direct cerebellar training. This is where everything comes together. Because improving blood flow is only half the equation. You also need to retrain the system itself. The cerebellum adapts incredibly fast when challenged correctly. This is called neuroplasticity, the brain's ability to rewire and improve based on demand. And the best way to activate it is through coordinated, multi-pattern movement. The first exercise is pelvic rotation, combined with arm and leg coordination. You rotate your hips, allow your legs to move naturally with that motion, and then add independent arm movement on top. Now your brain is managing multiple patterns at once. It feels awkward at first, and that's exactly the point. That's the cerebellum working. Second, spotting turns. You fix your eyes on a point, rotate your body, and quickly return your gaze to that same point. This trains your vestibular system, the part of your inner ear responsible for balance, and reduces dizziness over time. And finally, for those ready to go further, Sufi spinning. Continuous, controlled rotation that challenges your balance system at the highest level. This creates a powerful adaptation in both the vestibular system and the cerebellum. When trained progressively, it can dramatically increase stability and spatial awareness. That's why this entire category earns a 10 out of 10. Because this is not just treating the symptom, it's upgrading the system. Now let's go one layer deeper, because once you understand this part, everything we've talked about starts to connect in a very real, very physical way inside your body. There are 2 arteries that supply blood to the back of your brain. They're called the vertebral arteries. And what makes them unique is not just what they do, but where they travel. Most arteries run alongside bones and muscles. These don't. They run through your neck. Literally. Each vertebra in your cervical spine, the bones in your neck, has small openings, and the vertebral arteries pass directly through those openings, one level at a time, all the way up. Then, just before entering the skull, they curve, merge together, and form a single vessel called the basilar artery. And that artery is responsible for supplying some of the most critical structures in your entire brain. The cerebellum, your balance and coordination center, and the brainstem, the control hub for vital functions. So structurally, this means something very important. The blood supply to your balance system is physically threaded through your neck. Now think about that. If your neck is moving freely, if the joints are aligned, if the surrounding muscles are relaxed and balanced, blood flows smoothly. But if your neck becomes stiff, if certain segments stop moving properly, if muscles remain chronically tight, that pathway changes. Not dramatically, not suddenly, but subtly. A slight shift in alignment, a small restriction in joint movement, a constant low-level tension in the surrounding tissue. And what that does is create a kind of kink effect in the artery. Not enough to block it completely, not enough to cause something acute like a stroke, but enough to reduce efficiency, enough to slightly narrow the internal space where blood flows. And when that happens, not once, but continuously, day after day, month after month, you end up with a low-grade, chronic reduction in blood supply. And the structures that feel that first are the ones that depend on precision, like the cerebellum. This is why the symptoms we talked about don't appear suddenly. They creep in. A little instability, a little forgetfulness, a little mental fatigue. Individually, they don't seem alarming, but together, they tell a very clear story. Now let me show you what this looks like in a real person. I had a patient mid-40s who came in describing herself as just a bit clumsy. She was bumping into door frames, dropping things occasionally. Nothing dramatic, but enough that she noticed something wasn't quite right. Her first instinct was exactly what most people do. She assumed it was physical. Maybe she needed to exercise more, strengthen her body, improve her balance. She had already seen a general practitioner who told her something similar. Nothing serious, just stay active. So she did. And nothing changed. When I sat down with her and went through her full history, a different pattern started to emerge. She mentioned that over the past year, she had been forgetting words mid-sentence. Not all the time, but enough to feel frustrating. She also described a very specific kind of fatigue. By early afternoon, her energy would drop sharply, not physical exhaustion but mental, like her brain just didn't want to keep going. And she had never connected any of these things together. To her, they were separate issues. To me, they were one system. When we assessed her neck, there was clear restriction, especially at the base and the upper cervical region, the exact pathway where those vertebral arteries travel. So instead of focusing on her legs, we focused on restoring movement in her neck. Gentle mobilization, targeted release, nothing aggressive. At the same time, we introduced cerebellar training, the coordination exercises you learned earlier. Within a few weeks, the changes were noticeable. She stopped drifting when she walked. Her movements became more precise. Her family even commented that she seemed more present in conversation. And the afternoon mental crash? It gradually faded. This is what happens when you address the system as a whole. Not just the symptom, but the pathway behind it. And this is the key takeaway I want you to hold on to. Your body rarely fails randomly. When something starts to feel off, whether it's your balance, your memory, or your energy, it's often a signal, not of damage, but of reduced efficiency. And when you restore that efficiency, mechanically and neurologically, the body responds faster than most people expect. Now let's bring all of this together. Because information without a clear plan is where most people get stuck. You don't need to overhaul your life. You don't need complicated routines. What you need is consistency, applied in the right order. Here's your daily protocol. In the morning, start with the foundation. Spend just 2 to 3 minutes mobilizing the base of your neck, specifically the C7 to T2 region. Move gently. You're not forcing anything. You're simply restoring motion to an area that has likely been restricted for years. Then follow that with proper neck stretching, controlled, precise, and targeted. Not random movements, not aggressive, pulling just enough tension to release what's been holding that system back. This is how you improve the pathway. In the afternoon, shift your focus. Now you're not working on structure. You're working on function. This is where pelvic rotation comes in. Slow, controlled movement. Let your body coordinate. Let it feel unfamiliar if it needs to. Because that slight awkwardness, that's your cerebellum waking up. That's the system recalibrating. Then in the evening, you reinforce it. Practice spotting turns. Fix your gaze, rotate, and return. Over and over, training your balance system to stay stable even when your body is in motion. And if you're ready to take it further, if you want to accelerate adaptation, you can introduce Sufi spinning gradually, safely, progressively, because this is where your system is pushed to grow. Now here's the part I want you to really understand. You are not weak. Your body is not breaking down in the way you might think. What's happening is much simpler than that. Your control system is running on reduced input, less blood flow, less oxygen, less efficiency. And when you restore that, things start to change. Your balance improves. Your mind feels clearer. Your energy becomes more stable throughout the day. Because your body has always known how to function well. It just needs the right conditions. This is why consistency matters more than intensity. Small actions, done daily, create real change. So here's what I want you to do. Commit to this for the next 30 days. Not perfectly, just consistently. And as you go, pay attention. Notice how steady you feel when you walk. Notice how often you forget things. And if that starts to shift, notice your energy in the afternoon. Because these are the signals that tell you something is working. And one more thing. If you recognized yourself in what we talked about today, don't ignore it. These early signs are where you have the most control. Leave your age in the comments. Because where you are right now, whether you're in your 40s, 60s, or beyond, changes how your body responds, and it changes what you should prioritize. And it helps me guide you better in what comes next. Start today. Because the sooner you restore the system, the easier everything else becomes.